Welcome to the podcast, Dr. Taz. When I saw not only your book, but what you do in my inbox, I was like, I love hormones. Let's have her on.
Hormones are a superpower for sure, but they can work for good and they can also drive us insane.
Yes, they can. They certainly can, which we will get into. So you were part of just the typical medical community, doing what all Western, I'm assuming Western medicine, taught you. And I would love to know, you were in the ER.
Hmm.
What what made you shift into this arena, which is a highly, I feel like now people are talking about it, but as of almost 2 years ago, I feel like no one was talking about this.
Yeah, and realize for me this journey was almost 20, it's hard to believe, almost 25 years ago. So I was in my 20s, straight out of med school residency, working in, the ERs and loved it. I loved what I was doing, loved that I was actually working finally after all those years of school. But my own health kind of propelled me in this direction. And it was completely unexpected, completely accidental. And I never in a million years thought that this was the type of work I would be doing when I set out to, pursue a medical career. But, I was having all kinds of symptoms, many of which were not typical, many of which conventionally we don't take the time to kind of put the puzzle pieces together and dig in. And, I don't want to bore everybody with everything that was going on with me at the time, but like I was having everything from weight gain, joint pain, hair loss, like really extreme hair loss to where at first I would like hide and try to cover it up and do all the things that we try to do to pretend like it's not happening until like actually patients in the ER, the ones that were coming, and using the ER as primary care were actually starting to make comments and they would be looking up here at my scalp and not like engaging, with me. So I just got really shameful. I mean, I went from being, this really high, I mean, I've always been high energy, but like the super high energy girl wanting to go out all the time and a lot of fun and, loved having friends and all that stuff to really retreating and not wanting to go out, afraid to get dressed, getting dressed with like the lights off, like all this stuff. And we're so strange. Like our intellectual and our emotional brains are so disconnected sometimes. Like I knew a lot, but like just how I felt was way beyond anything I could do in terms of my knowledge, right? And so it finally took like my husband, we were dating at the time, and my mom to be like, something's wrong. You don't look like you're not acting like you. I think you need to go get checked. And so that's when I started, really jumping into our medical system and going to all the appointments and trying to do all the things. And it was really incredibly disheartening is probably the best way I could say it. I mean, I was told I was stressed. I was told I was depressed. I was told I was anxious. I was told it was normal. I mean, there were so many things I was told, but the whole time as these months were going by, like I'm turning into a different person. So, long story short, there was an incident where I finally went to this very well-renowned hair loss specialist. He put me on a medication. I left. I took the medication one day when I was headed out to the gym. That medication drops your blood pressure. Many people may even know what it is. But again, I, in my fog that I was in at the time, went and worked out, took the medication, jumped in my car after getting ready and taking a shower, and my blood pressure must have bottomed out. I had a syncopal episode, but I was driving, so I ended up crashing my car. And so it was kind of like it took that to be like, okay, this is not working. Like none of this is working. I need to figure this out. So that sent me on this path of pursuing holistic medicine, Chinese medicine, Ayurvedic medicine, which I'd kind of been exposed to growing up, but didn't really truly embrace it, the power of nutrition. And then finally, doing the integrative medicine fellowship with Dr. Andy Weil, which I finished that fellowship in '08, I believe. And it was my husband who was watching this whole journey. We're married now. It's like, I think you need to do something with this. He goes, like, everyone around you is asking what you're doing. You've changed your own health. You're back to being you. And he goes, why don't you just see a few patients, like share your knowledge? You've accumulated all this knowledge over the last 4 or 5 years of this journey. What can you do? And both of us thought it was really just about helping a few people, and this was going to be a hobby. He's even positioned and pitched. I still laugh at it. He's pitched it as like, you don't have to worry about overhead. You don't have to worry about anything. He goes, I've got the staff up front. He was opening his dental office. He goes, take the 2 rooms in the back, show up when you want, just like, share this stuff. And so our master plan as a family or as a couple, I had a 6-month-old and I was, pregnant with my second, but our master plan was actually like I would do 80-hour shifts and I would come into this sort of clinic, like this hobby clinic 1 or 2 days a week, leave by 2 or 3 every day. And that's just not what happened. And it turned into something very different. But it's been a joy and it's been such a journey, and I wouldn't trade it for anything in the world. But I and he, both of us, never expected that my journey would turn out this way at all.
What I'm shocked by continuously is your journey is not singular in the amount of women I know that are like something's wrong and they go see tons of specialists, and it's like women have been abandoned in this journey of everything that happens to us, and I feel almost betrayed, I'm going to say it, by Western doctors, medical doctors, mental health professionals. And they're just like, just take this SSRI or just take this blood pressure pill or this is normal. And having gone through my own hormonal disruptions after the fourth baby, which I didn't expect, I'm like, it's not normal and it can be handled. And it like gets me like so angry that aren't enough of you and that women who don't know of you yet are encountering this. So let's get into the hormones and what you do and what makes you different. Why does this happen to us? How can we do about it?
Well, I mean, I think there are a couple of things, and you just touched on it. Like the archetype, I think, of the hysterical woman has been handed down for over 300-400 years or so. Women were actually originally the healers of a community, and somewhere along the journey that got taken away. But if we look at Eastern systems of medicine, which are so old, they recognize that. Not only did they recognize that, they talked about the journey of a woman, and that journey of a woman was very much tied to her hormones and the different stages of life that she enters, whether she's a teen girl, whether she's going into her 20s, 30s, 40s, 50s, and beyond. And in those systems of medicine, when you hit menopause, which was 50, 60, however they defined it back then, that was actually an accomplishment. It was not you being swept under the rug. It was an accomplishment where you were held up as the matriarch of the family, you were the mentor, you were the elder, and everyone came to you for advice and counsel, and that was your new role, and it was an honor. So we've gotten so far away from that, and what we've done with sort of the industrial revolution and the westernization of medicine is we've tried to reduce everything down to parts and to details without connecting the whole. And we as women don't work that way. One hormone shift impacts our brain, our bones, our skin, our hair, our cognitive ability, our mood, our sleep, our sex drive, and so much more. So it doesn't work for women. And that's why the system has failed women. And then it's also been a system that's been driven by research done on men, really not including women in those conversations. So a lot of people like to throw around, well, there's no research around blah, 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 blah. Well, I go, because you haven't done it. The research is not there. So don't throw the research, thing in my face constantly when we're watching people suffer day in and day out when it comes to the exam room. My journey was 25 years ago. It's still happening today. Day in and day out in our clinics, I meet very young women, my daughter's age at 16, women in their 20s and 30s who their diagnoses have been completely missed or dismissed, and they get put on these tracks. Oh, you can't get pregnant, here's your IVF track. Oh, you have PCOS, here's your birth control and your spironolactone. Oh, you have endometriosis, here's your laparoscopy. I mean, it's just like these very singular tracks, because medicine today does not think holistically. It doesn't think about the whole picture. The model's not set up that way, the doctors are not trained that way, and the patients are kind of like little ducks, like on these little systems, like kind of quacking along until the bottom falls out. 50% of the time you might be okay. But what is showing for women is that over 40% of us are gaslit in our medical encounters. So the model and the system and the research and the delivery is not working for us because it's not honoring the fact that we indeed are hormonal fluctuating creatures that go through different life stages that have different needs. And all of them don't need pellets and patches and pills, right? There's a lot of other things we can do. I mean, I'm on this bandwagon of women right now, but as I'm having these conversations, like I don't think men are treated fairly in this either, to be 100% honest. I think there's like this archetype that they're held up to, and then they hit 40, 42, 43, and like that their bottom falls out, but because they don't have a cycle like we do to maybe track or understand, or they're not as physically aware as maybe we are because of, the fact that we have children and all these other things happen to us, they're struggling too, but they get labeled as a midlife crisis, as a grumpy old man, as, whatever else. So it's just a failed model, in my opinion, really fails women, but also impacts the entire family and impacts men and children as well.
I guess in your practice, what have you seen in terms of results? I'll share a little bit about mine. After fourth baby, sex drive was like less than zero. It was like, don't touch me.
Right.
Tired, bloated, all the things. Finally get my hormones checked. My estrogen was 30 times per the ratio that it should be at, like 30 times more than the progesterone. And the doctor was like, you should be totally batshit crazy for how out of whack this is. I'm shocked you're not like getting a divorce. And then I took it and I was told like, okay, give it, 3 to 6 months to like kick in. And I'll never forget the day it kicked in. I was like, woke up and I was like, oh, I like my husband again. And
Mhm.
like all the midsection weight gain that, and the bigger breasts, like it's all going in a way that I was like, thank God.
Yeah.
And now I feel like I'm at a clip that is manageable and I'm not even taking that many, I'm not even taking it that, it's a very small dosage, but how do women even know where to start? Like if they can't get an appointment with you, and we'll get into your book as well, how do you get into this and not get overwhelmed by what you need to do?
I mean, I think it starts, first of all, by understanding it, we as women, and I think what we also need to hand down to our girls is ownership of our bodies, right? Like just understanding our bodies and not kind of giving in to what we're hearing around us. I was having this conversation with my daughter last night. She's like, Mom, everyone's on birth control, everybody. And I'm like, if you need birth control for birth control, yes. But if we're trying to do hormone balancing, then no, so not falling kind of into this like, oh, well, I just need to do this and I'll be fine. I think it starts with us, honestly, diving into our own health and like how we feel. And if you are feeling differently, period, end of story, whether it's mood, whether it's cognition, whether it's weight, whether it's libido, it doesn't matter. But anytime you are shifting and feeling differently, that needs attention. And the
Yeah.
first place to go when you're trying to get that, when you're trying to problem solve that issue, get your levels checked. And it's not difficult anymore. You can go to LabCorp, you can go to Quest, you can do a saliva test, you can do a urine test. There's so many different options out there today. And everyone gets really academic and all bent out of shape about which one's the best and all this other stuff. These are all tracking devices. So just pick one and stick with it, And the one thing I did do in the book is sort of give an interpretation range to help. But even that, at the end of the day, you are you, And so what your normal is going to be different than what my normal is. And we have to accept that and understand that. So I think yearly, twice a year hormone tracking, even for somebody as young as my daughter, who's now 16, I think is essential. That's the only way we know kind of where we are. And some of that you can manage yourself and you can start to see, you would have caught your estrogen being too high, if you had a standard to compare it to. So I think that's the very first place to start is just get the information, just be more intentional and more aware of yourself, especially if you've had a child and you're coming off of that, or you've had a stressful event, or you've gone through a divorce or a trauma. Things are going to change and they're going to change hormonally because that's the first place that we really see it in our female bodies. I think after that, you have to find a partner. It's hard. You can get so far with trying to manage it on your own and looking at everything we talk about with diet and natural remedies and things like that. You're going to have somebody who can pull back and be like, this is the lever to pull at this time. And yes, there's me, there are others like me. Our practice is growing and expanding rapidly, and there are resources there. There are people out there who are doing this. Now, they may not be in your conventional world. There's some amazing, brilliant conventional Western medical minds out there, but they haven't had the luxury or the time to sit and really like digest this hormone material, right? Even your GYNs, as much as I love them. Like they also kind of run in singular tracks, like getting someone pregnant, helping somebody in menopause, helping somebody with perimenopause, but they're still not thinking holistically. So I think you need to find a partner to work with that you're comfortable with and then start to like move these things forward.
I was on Instagram. I follow a couple women in this space and they were interviewing female doctors. How much training did you get in medical school about menopause and women's
Right.
hormones? And they were like 30 days out of the 8 years or whatever it is. And you're just like, this is fucking crazy.
It's negligible. I mean, it is. And even like the education around hormones, I think is negligible. It's about getting pregnant, what pregnancy looks like, what postpartum looks like, maybe just for a few weeks postpartum. And that's kind of it. I feel
Right.
like that's about all you're getting. So, we just need we need a better system. We need a better model.
100%. One of the things I just sent to my photographer went out on mat leave and I was like, how's it going? She's like, I'm struggling, emotionally. And I sent her this quote, which I'm sure you're familiar with, but that postpartum is the biggest hormone change in the shortest time span any human ever experiences. It's faster than puberty, menopause, or any other big change you can think of.
Absolutely. It is a bottoming out of all your hormone levels,
Yeah.
you
And
know.
then these women go get put on SSRIs without anyone doing anything. Maybe she needs it. I'm not going to say, but like that's the first step. And you're like, wait, all her hormones just bottomed out. And your answer is to drug her brain, right?
Yeah.
And
It's
it pisses me off because then you take this fragile person who just wants a solution and you're not actually handling the source of it.
I
Just
know.
crazy.
I know. It's beyond crazy. And so much of postpartum could be prevented. That's a whole another topic. But again, Eastern systems of medicine thought through this, right? They're like, there's preconception, there's postpartum planning. You weren't left on your own to raise a child. You had like 30 other women around you to help you out because they anticipated this, there's just, again, I could go on forever and probably, just being like a list of all the things I'd like to see change over time, for sure.
What would you say to women who are listening, who feel stuck in the I believe my primary care doctor? So I have a very good friend. The minute I mention anything alternative, the eyes glaze over. She's like, I'm going to check with my primary care doctor. And I want to punch her in the face because I'm like, they're going to tell you that everything I'm telling you is quack.
I was that quack. That's what I was labeled when I first started over 25 years ago. But I don't, and actually, you know what? Honestly, that very comment is the reason why the practice transitioned, even if it was a practice to begin with. It transition from this little hobby. Taz is going in 2 days a week to see 4 or 5 patients to like, no, we're doing this. This is a mission. This has to happen. Was for that comment specifically that I would dispense information. They would go to their primary care doctor or whatever doctor. They were told I was a quack or the information was useless. And the poor patient sitting there like, oh my God, who do I believe? Like, do I do this or do I do this? I'm like, this is BS. So I remember being like, this isn't going to work. I'm either all in, this has to be a one-stop shop. This has to be a medical home. People have to be able to do it all here, get all their answers to everything. We can't do the whole consult thing like, oh, go get your information there and then go have a internal fight with all this stuff that you're getting. I just would advise women to wake up, and understand that your primary care doctor is probably incredible, but they are constricted and they are limited by their training, by the medical model that they have to practice within, and by time, by just not having the time to even spend with you and dive deep, even if they want to. I still maintain doctors, the majority of us went into this profession because we truly felt a calling or a desire to be with people and to help people. I do, as Pollyanna as that sounds, I still believe that. But what happens is that this model, 10 minutes, 12 minutes at the most, maybe 15 to 20 if you're in a concierge practice of some kind. But without the training and without like thinking through how hormones are impacting every aspect of your life, they're only going to be able to give you singular answers, you know? And you wouldn't like renovate your house with one opinion. You wouldn't, invest in finances with just like one sort of, magazine article that you read. Why are you doing medicine with just one opinion? Why would you not put a team together to help you really think about your health in a little bit more of a strategic way? So the primary care doctor belongs on your team. But if they're not trained in like all of this other stuff, then you need to get additional team members on there so you can think just as strategically about your health as you do about your house or your finances or your children or anything else, or even a trip that you're taking on vacation, right? So I just think we don't give it the importance and the attention it needs, and I think we need to change that.
So you're changing that with your book, The Hormone Shift.
We are trying, definitely. So my latest book was The Hormone Shift. It talks a lot about this sort of holistic approach to healing and to health and what that really means. It doesn't mean, you're only staying on the natural side of things and you never take a medication and you never take a hormone. That's absolutely not what it means. It means that there's just an expanded toolbox. And
Yep.
that toolbox is one that, different people enter at different places in that toolbox, depending on what's going on with them. And that's exactly how we practice in our clinics. Our clinics have been, very successful, and we continue to grow and expand those as well, because this is what people want. But at the end of the day, it's also what serves people the best. They have more long-term results. They have more understanding of their own personal chemistry and their health. So you make all decisions from that framework. If you're somebody prone to estrogen dominance, well, then everything we do has to be thought through in that framework. And so I think that the book is a resource for everyone. We have so much on my blog and on my socials, same thing, a resource for everyone. At some point in the journey, if you want to be a patient, that's probably your next step in this journey, but that's available. But there are just so many ways to dive into this conversation and to really empower yourself so that we can change this, and I think I get frustrated because here I am sitting, at 52, hearing young girls, in their 20s and 30s having the exact same experience that I had all those years ago. And I mean, we have to do something differently.
Yep. What would you say to, I doubt that over 100 years ago, the changes that were in young girls were occurring in the way they are now with regards to periods being so early, the sassy, bitchy, like, you know, teenage girl situation that I feel like is sprouting within my young daughter.
I have no
Um,
idea what you're talking about. We've had some rough years. Good God.
oh my
We
gosh.
still do, not to be candid, but I mean, last night she literally used the F-bomb on me. I'm trying to help her. And I'm like, you
Yeah,
do it again. And, but it's just like, I would have never spoken to anybody like that. What the hell,
I
So,
know.
but
I
anyway,
know.
yes.
It's wild.
Yeah.
But what do you think for young women? Like, how obviously you can't treat a general swath, but what do you think is happening within young girls that seems to be at an escalated, almost exaggerated um time?
I mean, I think I could summarize it really down to two words: liver and cortisol. I think that livers are under attack. There are more toxins in the environment than our time. I think that everything from food quality to what they're using, the air they're breathing, the water they're drinking, like all of these things are very different. And again, the medical system's not caught up to that. So it's practicing in a little bit of an archaic way, but that in itself can explain a lot of like the early puberty, the estrogen dominance in young girls, the, PCOS epidemic that we're seeing. But we're also missing out that you have that part of it that contributes to the mental health crisis. But then you also have a culture of social media and 24/7 access to everything. These girls are turning into women in middle school and, late elementary school, And, that's why they're using the language they're using. That's why they're acting the way they're thinking, because they are 11 and 12, but they think they're like 23 and 24, because they have access, and it's funny to even listen to my daughter because she's 16 now, but she's like, I went to Sephora and like there are these little middle schoolers in there, like trying on all this makeup and doing all this stuff. I'm like, you were one of them actually, but like in her perspective, you know, it's just like a lot of our childhood is getting taken away, I think. And so, I do think social media is a really huge problem. I'm actually super excited to see more conversation around that because it just messes with everybody. But I think this environmental toxicity combined with sort of the culture that we're in now, where kids are in 20 sports and 15 activities, and college is super competitive. So everybody feels like they're just on 24/7. I mean, I think there's something in the mix of all of this that is just creating havoc with our girls, and mentally they're not okay. Our girls are not okay. I don't think our boys are okay either, but I think our girls are really at risk.
Yeah.
And I'm concerned enough about it that I think it might be my next book, but I do think that, all of us as mothers have to be aware of this. It's just so hard, even when you're aware, to wrangle the culture and to wrangle society. It becomes very difficult because so and so is getting a phone and so is doing this and so is doing that. So I don't have all the answers by any means. I really want to dive deeper into this topic, but it is a problem. And it is a part of why we're seeing everything from early puberty to many of the other mental health disorders in our girls.
Yeah. I don't know if I felt like, and I can't find it anymore, but Adele Davis had a chapter about supplementation for girls going through puberty.
Yeah.
And that helped with the like hormone rush, like that first dose. I can't find it to save my life, but have you seen that support can help a girl have less of the
Ups
roller
and downs.
coaster?
Well, we talk about it in the hormone shift. There's a whole
Oh, good.
chapter on teenagers, and I call them the rock stars because I feel like they act like rock stars. Like they're up one day, they're down the next, they're all over the place. But yeah, it talks a lot about like what we can do to support them, whether it's taking herbs and supplements, to helping them calm their nervous system down, to food, what can you manage with food with them. One thing about them though, I'll give them credit, they're actually willing to engage in conversation around this. I think that I have noticed, is that they are curious and they are interested. It's just, again, how you deliver it and making sure what we're giving them is not too complicated. Like, here are the three things I need you to do, do
Yeah.
X, Y, and Z, and as long as we can keep it super tight and simple, I think they want this. They want this type of medicine and care just as much as we want this too.
Yeah. How have you dealt with if you have been attacked? I know you said it happened early on, but I feel like I see a lot of alternative doctors still getting attacked by the medical, whatever, complex because you are going up against a very profitable cash machine. And
Yeah.
have you dealt with that and how do you deal with it?
I think I have for a long time. I think at this point in my career, I have a little bit of a Teflon coat where I kind of don't care anymore, if that's the right way to say it. I think I used to get really, in fact, my own med school buddies were like, why are you doing this? Why would you jeopardize your name and, your reputation and do this, So it took a while for even them to get on board, but I just know that it's a mission. I don't know how else to say it. I just know it's a mission. I know it's probably what I'm here to do. And I'm not here to isolate any type of medicine. I'm just saying we need to expand what we're doing and we need to deliver it in a little bit of a different way. And so that's why, like, our practices are full of conventional doctors that we've trained, right? And we very much believe in the MD and the NP and bringing them, bringing those academic qualifications into this sort of field of medicine. And I think that ultimately is what's going to give it the respect it deserves. We today have doctors refer to us, from Mayo Clinic and Hopkins and all these different places because we've earned that respect over time. It wasn't always there. You're going to continue. It's funny, when the book came out, there were a couple of folks in the medical community who were implying that I was not a doctor, I was not this, or I was not that. And I just kind of remember putting up my resume being like, actually, this is what it is. So I think that my hope is that we can stop the fighting and we can stop like the sort of territorialness that, that people seem to have when it comes to medicine. It's on the other side too, by the way. It's on the natural side too. You have, many a chiropractor and naturopath just getting just as territorial as some of your MDs are. So really what I want to say is let's put our egos away and check them at the door to really create a healing model and a model for health that's going to last and make a difference for everybody. We need everyone at the table and we
Yeah.
need collaborative and cooperative. So, I feel like anyone who's going to continue to blast, either me or others doing this type of work, they're on the losing end of this journey because this is the future of medicine. And it's almost like choose your sides. If you're going to choose the other side, that's the wrong side.
Yeah. I love that. That gives me hope that it'll change faster.
Well, we're trying to make it happen, and I know I'm not alone in that. There's so many that are brilliant and gifted and doing the same, trying to really push all this forward. I would say that we have to come together though. We can't, for a while I used to hide too. I'm like, I'm just doing this thing over here, like no one look at me, that type of thing. And now I'm like, yeah, no, if we're going to change medicine, we need to be out there. And so we're just pushing forward.
Yep. So where does someone start? Like if they can't get in to see you,
Yeah.
or, where does even one go? Because I struggle with who do I refer someone to, right? And I end up giving that one website whose name escapes me. And then it's like searching for any doctor. It's just naturopaths and you don't know who's good or bad. Like where does someone begin?
Yeah, I mean, first of all, look, within our clinics, it's not just me, that we have about 10 to 12 other providers and we're actively hiring as well. And they're all kind of trained in this way of thinking. So there's that as a resource. But then I always refer back to two kind of central places. So the fellowship I did at the University of Arizona Integrative Medicine, they have a website which kind of lists throughout the world where doctors who are trained in integrative medicine are. So that might be a great resource to look for somebody who, really focuses on women's health, because then they're going to use this language around hormones and things like that in a very similar way to I am. And then there's the Institute of Functional Medicine. They also have a website with their certified practitioners. There's also A4M, which also has a website with certified practitioners. So you just want somebody who, and I really like to be 100% honest, and this might be my bias, but I like the person who's gone a traditional route, but then has gone and gotten additional training, right? Because then they really have this depth of knowledge. The ER was tough. And there's stories there from the ER that someday I need to write about. And they really almost hurt like my soul, some of the things that transpired there. But I was telling my husband the other day, I was like, I'm so glad for those 12 years there because it really educated me about medicine and what can go right and what can go wrong. And I brought that into my clinics. So I feel like somebody who's done that work, they have really gone above and beyond and they have that mission and that desire in their heart to really push you forward, which at the end of the day is the most important thing.
I love that. How do you manage being the face, right? To the degree that certain higher level, the Gwyneths of the world want you. You have all these clinicians, you have clinics, you're writing a book. How do you manage your time now that you're not seeing? I imagine you're not, I know you're not sitting in an office every day just seeing back to back
Yeah.
patients.
No, that was hard for me. I'll be honest. I'm down definitely. I see about 50% of the volume that I once did. And that was a huge leap of faith, right? It was like, oh my God, are they gonna be okay? Is everyone gonna that took a lot, and it took my team being like, we got it, we're fine. So that leap of faith happened. And what it did is it freed up my brain. And it was the greatest gift my team could have given me because, in my like sort of natural empathy state of like wanting to make sure everybody's okay, it was taking away from the company and it was taking away from our growth and from my ability to be able to mentor and to really drive our strategy and our vision moving forward. And I literally feel like someone like like reached in and took, like all this weight out of there. And so now I understand it's necessary. It's not something I want to do. I had somebody call me the other day, "Oh, do you never want to see patients again?" No, like I'm going to see patients till I die. I learn in there. That's our lab, to be 100% honest. We learn from every person that comes through there. But to do it at the pace and the volume that I once was is now a disservice to everyone. It's no longer in service. So once I understood that, that was a game changer. And I just feel like it's my responsibility a little bit to do this, right? It's my responsibility to run a successful company. I have incredible people working for me. I feel like I have a sense of responsibility to them now. It's my responsibility to get this mission out there and vision out there. And then there's a lot when you sit at 52 and you look forward, and I know I'm going to be vital and productive probably for another 30 years. There's also a sense of legacy, right? Like, how will this live on beyond me and the words coming out of my mouth? And so it's really important for me at this particular phase to raise the next generation of physician leaders, in this industry. And so that's sort of, to me, it's just important. So how do I mean, time is always a resource, right? But it's just taking it one day at a time, 1 week at a time, 1 month at a time, and doing, the work that's needed to be done, and then pulling away. I think this year was the first year I actually had, 7 or 8 days all to myself. No kids, no husband, no work, no meetings, no media, nothing. And it was incredible, and so I would recommend anyone, who's juggling a lot is to try to do that, because I feel like what it did was, again, clear clutter out and allow me to be very much, okay, well, this is what I need to do. And it was, again, helpful for my team and for my family, because it was less of me just sort of bebopping around and being like, oh, okay, this is a waste. This is what we need to do. And then moving forward. So I think having an incredible team helps. I think having time alone helps. I think, caring for yourself helps. I'm only as good to everybody else as my strength and my energy, allows. So I really prioritize a lot of that now.
I love it. I love it. So where can people buy your books?
So the Hormone Shift and my other books are on Amazon, Barnes and Noble, anywhere, that books are sold, for sure.
Great. And if someone feels like, oh my God, what do I do? The urine test? Do I do a blood test? Like, do you have a favorite? Because
So I
yeah,
say do whatever you can.
okay,
I get results from both, or we can make decisions essentially based off both. Just do what you can. Some people like spitting in a cup, some people don't. They can't produce enough saliva. So then do the urine one. A lot of that we had helped people with in practice in the
okay,
clinic. And then I also have a community of women. So feel free to join that as well for questions, around some of these things that might need more nuanced answers, for sure.
okay. And where does that community live?
So they can go to drtaz.com, which is my website, /superwoman, and that's that community.
I love that. We share a fun name.
Yeah, we do. I know. I saw that when I was looking at your stuff. I was like, oh my gosh, That was my 2017 book, The Superwoman RX, really talking
I
about
love it.
how we as women have to have a formula for taking care of ourselves, and what I had learned in clinic. So
For sure. Well, I can't thank you enough for what you do for women. It is so needed out there. And as someone who had my own personal reality with it, many in different ways, many times throughout my pregnancies, what you're doing is so important and urgent for women to take heed of. So thank you.
oh my goodness, thank you for having me on.
I just wanted to thank you guys for listening to today's episode. I also want to ask you to rate and review the show wherever you listen to podcasts. I know it's a pain in the butt, but it actually helps with search and algorithms. So if you love this podcast, it is an easy way to get it more visible and out there. I also want you to follow me on Instagram at Rebecca Minkoff, at RM Superwomen, and be sure to check out my book, Fearless, The New Rules for Unlocking Creativity, Courage, and Success. Thank you again, and you will hear from me next week.